Well, hello, Vardians, and welcome back to another episode of Healthcare Boulevard. This is a podcast where we explore all career options under the healthcare umbrella. We do this by interviewing professionals in each healthcare field. Within the last 2 seasons, we have covered social workers, speech therapists, acupuncturists, physical therapists, and the list goes on. My name is Sena Kakpovi. I am a physician associate, the creator and host of Healthcare Boulevard. Please tune in on Apple Podcast, Spotify, or your preferred streaming app. Without further ado, let's get into today's interview. I am here today with my very own sister, Douce Kakpovi. You will hear me call her Douce and Bruce throughout because, I'm her sister. Like, so her official name is Douce Kakpovi. But welcome, Douce. How are you?
I'm doing good. How are you?
I am well. We are here on this morning. Well, it's still morning for both of us.
Yeah.
But Juice is an RN and she's been practicing for a good amount of years. And I wanted to dive in here a little bit more about the word nursing. There's a lot of a few different titles that can fit into that general word nursing, and that include RN, LVN, and some may even consider CNAs. So we'll try to dive a little bit into the different scope of practice for those three, how to become those, how to gain those three titles, and the in and out of sort of some of the places they can work at, whether it's a CNA, LVN, or RN. So let's start from the top to bottom. How about that? Let's start with the RN. A lot of us here and know and have interacted with RNs one time at a point in our care. Um, how would you describe the scope of practice for an RN, Bruce?
Okay. So RNs, um, so between LPNs, RNs, and CNAs, RNs have
Mhm,
the highest level of education between the three,
mhm,
and they have a greater scope of practice compared to CNAs and LPNs. So RNs are generally responsible for coordinating patient care, assessing and monitoring patients' health, administering medications, doing diagnostic testing like blood draws, specimen collection, developing and implementing nursing care plans, and then providing patient and family education. Um, so there is a couple educational pathways to become an RN. For me, I did the NADN program. So I received my associate degree of nursing at a community college. And then I went on to take the board exam to receive my license as a registered nurse. The other option is also a Bachelor of Science in Nursing program. Um, And so that's like a 4-year nursing program. So typically, um, these programs take about the BSN programs take about 4 years to complete, and the ADN programs take about 2 to 3 years to complete. It took me about 3 years to complete my ADN program, and then I went on to study for an additional year to receive my bachelor's degree. Um, so after completing the nursing education, all nurses have to take the same exact board exam, which is the NCLEX, to
mhm.
obtain the nursing license.
Right. So with the and in your the settings that you've worked in, have you worked with an LVN before?
Yes.
Mm,
So I've worked in various different settings. I've been a nurse
mhm,
for um about 7 years now, and I've worked in home care, and I've also worked in a group home where I was a nurse case manager, and I've also have a little bit of hospital experience.
Mm-hmm.
So when I worked in home care, I worked alongside LPNs, and when I was working in the group home, I was a nurse supervisor for LPNs and then also the direct support professionals. Some of them have CNA certificates. Um,
Mm-hmm.
so I have worked I have worked with LPNs in a lot of the various settings. When I worked in a hospital, I didn't work with LPNs. We just had um, RNs and CNAs in
Mm-hmm.
the hospital settings because LPNs usually typically work in long-term care settings.
Mm-hmm. So, as an LPN, I mean, when you're working with an LPN, let's take the
Mhm.
group home setting, for example.
Yeah.
What is this? What are they doing with the patient? What is their role in the patient care? And you were the supervisor, so you were head, or you weren't doing as much direct patient care. Is that correct?
Yeah.
Mm-hmm. So, what were the LPNs responsible for, and what were some of your scope, like your responsibility in that setting?
Okay. So LPNs, when I worked in a group home, they worked directly under my supervision as the RN.
Mm-hmm.
So their responsibilities included basic patient care, like administering medications, taking vital signs, collecting patient data, and then assisting with ADLs, activities of daily living.
Mm-hmm.
And then, um, so they provided a lot of that direct care and they worked along with direct support professionals in that setting. And I, as the RN, was supervising, providing assessment, coordinating care by working directly with um, the patient's primary care physicians, their
Mm-hmm.
specialists, their nutritionist, physical therapist. So, bringing all those different fields together and then communicating directly with the physician, receiving orders, and then implementing, and then having the LPNs implement those orders.
Mm-hmm.
So, for
Mm-hmm.
example, if a patient um, had a high blood pressure, and that blood pressure was collected by the LPN will report that elevated blood pressure to me, and then I will communicate that to the patient's physician, and then um, just follow the order that or the recommendation that the
Mm-hmm.
physician provides.
Mm-hmm. So it seemed you had more, I would say, hands up and a little bit more autonomy in that setting compared to hospital where you're doing direct care, IVs, and all of that. Is that correct to say?
Yes. So in the hospital, um, it's a completely for an RN in the hospital, it's a completely different experience.
Mm-hmm.
Um, because yes, you are providing direct care, you're administering medications, you are um and then in the hospital, these are acute patients, because they're in the hospital because
Mm-hmm.
they're sick.
Right.
So their vitals are going to be off. Their vitals might be off, their blood sugar levels might be off, their electrolytes might be off. So my role in the hospital setting is just reviewing labs, paying attention to vital signs, paying attention to um, anything like all reported labs, and then practicing or making nursing decisions based on that.
Mm-hmm.
So it's definitely a more intense environment compared to um, when working in a long-term care setting, for
Right,
sure.
right. Which one of those two settings for you personally do you prefer and why?
Um, so each of them have their pluses and minuses,
Mm-hmm.
for sure, because hospital nursing is definitely a lot more physically demanding.
Mm-hmm.
Um, you are on your feet a lot more because, the schedule is a schedule and anything can happen at any minute. A patient could suddenly have a very abnormal vital sign, and then you have to call a rapid response. So you have to pay attention to those kind of changes
Mm-hmm.
in patient because that it is an acute care setting. Um, in the group home setting, we do have emergencies and like those kinds of issues do come up regularly. But when a patient has um, any kind of distressing issue in the group home, our role is to call 911, send them to the hospital, and then um, allow the hospital to do what they need to do to get the
Mm-hmm.
patient better. So
Mm-hmm.
those are the differences. So I will say hospital nursing is, especially lately because of the nursing shortage, it's a lot of
Mm-hmm.
um, 12-hour shifts, which usually turn into 13, 14-hour shifts. And then the hospital where I was working at, they have a rotating shift schedule as well, where you were expected to work day shift and night shift based on the needs of their scheduling. Um, but it's also, you only are expected to work 3 days a week, 3 12-hour shifts a week.
Right.
Um, so, and then once you're off, you're off. For the group home setting, you, because um, it is a coordinating, like you're a coordinator, you're a nurse supervisor, you do have a lot of responsibility to, because you have a lot of staff, you have nurses and you have CNAs working under your supervision. So you are
Mm-hmm.
responsible for that. You are responsible for the training, and then you're responsible for communication with um, all parties involved in the patient's care.
Mm-hmm. Mm-hmm.
Um, I liked, and then so I would say for me, I don't know. I liked both for different reasons.
Right.
Each area that you work at has like um its its plus and minus. What I didn't like about working in the group home is having to be on call 24/7. Um so um like during the weekend or at night you can be getting a call
Mm-hmm.
from from the from the staff or the nurses or whoever is working on a shift about the patient. So that's one of the drawbacks about working in the group home. But the plus
Mm-hmm.
is that, you have a flexible schedule, and you can kind of like make the schedule work for you instead of having a strict shift of like um, 8 a.m. to 4 p.m., for
Mm-hmm.
example.
Mm-hmm. And then
Yeah.
there's that being on your feet most of the time in the hospital setting. That's
Yeah.
not a problem in a group home, I'm sure.
No, 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 no. It's because
Yeah.
you're not giving direct as an RN, I'm not giving direct care. I'm not expected to be on my feet for
Mm-hmm.
12 hours. Yeah, when I was in
Yeah.
the hospital, like I didn't sit down to eat lunch until like 2 p.m., 3 p.m.
Mm-hmm.
from like my 7 a.m.
Yeah.
Yeah.
Yeah. So it definitely is, it depends on what you're looking for in terms of, more flexibility or more physically demanding positions. In the setting of, let's talk a little bit about CNAs. So it's tricky because as somebody who held the CNA position, I felt like it's not necessarily one that can be considered nursing because it is a nursing assistant. But I do know that some refer to CNAs as nurses as well, depending on the settings that they're in. If they don't have a lot of interaction with LVNs or ONs, and they just be like, oh, nursing. Um,
Mhm.
but by definition, it's certified nursing assistant. So you don't necessarily, it's an assistant position. A lot of time, from my own personal experience, I mean, I was working in an assisted living home,
Mhm.
and then I was working in a private duty. I know some CNAs work in hospitals. What are other places that you've seen CNAs worked?
So CNAs, I know, like you said, work in nursing homes,
Mm-hmm.
or other long-term care facilities. Um, they also work in hospitals, like med-surg units, so they give basic patient care in those areas, like taking vital signs, taking blood sugars, um, helping with ADLs and patient hygiene.
Mm-hmm.
And then they also might work in home care. So that's another, like, usually when they work in home care, they do like one-on-one care where they provide personal care. Maybe they'll do some housekeeping,
Mm-hmm.
or just ensure that the person is um basically ensuring that the well-being of the person that they're supervising. And
Mm-hmm.
they, during that time, they work under the supervision of a nurse or a therapist. I think you did home care before, right? As a
Yeah, I
CNA?
worked like my 4 years of CNA was pretty much equally divided, 2 years in assisted living home and then 2 year in
Yeah.
home care slash, some people call it private duty. And it's exactly what you're describing. So in the assisted living home slash nursing home, you have a lot more patients in your hand for sure.
Yeah.
Like, I think it was like 12 patients per unit that when I was working
Mhm.
there, and it was like two caregivers or CNA at the time. So, essentially you had like six patients to yourself. And as in at that level, you're responsible for their essentially every need, showering, changing diapers, feeding, they're screaming left and right, calming them down, making sure they don't eat too much if they're diabetic because someone like just gravitated towards the fridge 24/7.
Right. Yeah.
Um, and like in my setting, and it's very common to see in assisted living and nursing home, we had a lot of Parkinson's disease, dementia, Alzheimer's. So a lot of they weren't just elderly, but they were elderly with, memory
Yeah.
um, uh, deficiencies and so forth, those diagnoses. So there's all of that that plays a role into, their behavior, how they hold themselves and so forth. So it gets to be a lot, and you are definitely on your feet 24/7.
Yeah.
Absolutely.
I think,
Absolutely.
yeah, nursing home has to be the most um demanding for sure. Even
Hmm.
for, yeah, for CNAs, even for LPNs and RNs. From what
Yeah.
I've never worked in a nursing home, but I've heard that it definitely is like very grueling, very physically demanding, just based on like the number of patients that you have
Right,
to
right.
work
And
with.
it's usually not, as far as patient caregiver ratio is usually not necessarily what you want, right?
Yeah.
So, um, and especially the daytime, because I was mostly working day shift. Every now and then I would do night shift, which was much, much different because a lot of them were sleeping. So only had to tend to those who woke up in the middle of the night or what have you,
Mhm.
versus daytime where everybody's up doing their own thing with their own, shenanigans. But then in private duty or home health, you just have one patient. You are just, taking care of that patient. Usually there isn't much cooking really. And same thing for the nursing home. They have the kitchen
Mhm.
does that, but
Yeah.
they might like warm up something for them or what have you. Um, if they're watching TV, you're watching TV. Like it's just one
Mhm.
patient. And so, if they're taking a nap, that's 2 3 hours that you have to yourself to do. At the time I was in school, so do school work or what have you. If you happen to work night shift, even sweeter deal because they're sleeping at least five
They're
hours
sleeping.
of your shift.
Yeah.
So you can either do homework, take a nap, or so forth. So as a CNA, really, I would definitely say the home health is the sweeter deal for sure in terms of exertion at work, in terms of
Yeah.
how much tired you can be after your shift. And
Yeah.
if you happen to pick up a night shift, enjoy it. It's just like that's how I was able to survive the last 2 years being a CNA full-time and working. But it's definitely a good place to start as a healthcare professional, like or get start into healthcare for sure. Because I mean, if we're talking about education, back, I don't know what it is now. I know every state is different. I did, as you know, I did mine back in Maryland. So the licensing was about a month, no more than 2 months, if I recall.
Yeah. I think
Um,
so, yeah.
yeah, and it wasn't any more than $1,000 or $2,000. Um, Matter of fact, I was able to afford it in undergrad, so I know it wasn't that much because I was very broke. So, but I've heard over here in where I live now in California, I've heard even CNAs and medical assistant or two titles that oftentimes are good entry level titles into the medical
The
field.
medical field.
But I've for those who are MAs, I've heard they spend a good amount of money on that license. And it can take like 9 months or like 6 months or what have you. So it's totally
Or
different.
medical assistance? Okay.
Yeah. I
For
don't
CNA,
know. Yeah.
I don't know how much it is. How long would it be for CNAs in California? Maybe like it shouldn't be longer than like 2 or 3 months though, right?
Right. I don't know what the MA training is back in Maryland either, because I was never an MA. I was a
Yeah.
CNA. For some reason I sort of put them in the same category, level of education, but there seemed to be a difference in terms of level of no, not level of education, in terms of length of education and price and cost, at least over here. But those are all things to think about because MAs, it seems, have more, there's more setting they can work in terms of like doctor's office. It's all every doctor's office I've been to as a patient or as a provider have MAs.
As an MA.
Yeah, whereas
Yeah,
CNAs are not that common to see in doctor's offices.
that's what I imagine is that MAs work directly under like a provider, and then
Mm-hmm.
CNAs work directly under nurses.
Mm-hmm. Mm-hmm. Yeah, I mean the title is pretty telling too, right?
Yeah.
Um, and so more times, as you said, you'll find more MAs, like in clinical settings in terms of like acute patient care or like outpatient and so forth, taking vitals and updating the providers versus CNAs where they can be in the full care of the patient in terms of ADL and so forth.
Mhm.
So I guess depending on what your goal is, in terms of what you want to do in that entry level stage as a as a newcomer onto the field, then that would be, you know, then you can decide. And also cost plays a role in length of education. I got the CNA because I was like, oh, I can do this in the summer real quick, and it's only like $1,000 or $1,500. I can afford that, you know. Now, if it was a
Mhm.
4-month, 5-month training with $5,000, I will probably not have done that. So,
Yeah.
yeah, it's two different things for sure. But I think I spend way too much time on MAs, but now we know about MAs compared to CNA.
Yeah. It is, and CNA is a very like if you're interested in the healthcare field and you want to try it out and get your feet wet just to see what it's like.
Mm-hmm.
CNA is definitely like something that you can do because there is a lot of settings that you can work at. You can work in the hospital, you can work in home care, um,
Mm-hmm.
you can work in nursing homes. So you have a lot of versatility when
Right.
it comes to that, and it's not a long program, so you can spend 2 months, 3 months to get the
Mm-hmm.
certifications, and then you can
Right.
apply and try different areas to see where
Yeah.
you work. And I know a lot of people who are like um, who come here from who travel here from out of the country, um,
Mm-hmm.
immigrate here, and
I don't come here from another country. You
immigrants,
mean
and
like
like
the way we did?
yeah, so like and like when you're at fresh in the country, when you want to get started, you want to start working, you want to feel like you're being useful,
Mm-hmm.
and like getting your
Mm-hmm.
CNA is like one of the easier things to do to start working and like getting that work experience.
Right, right. So I mean, especially where I want to say grow up, but back in Maryland, where we spend out most of our time, including myself, it's like you see a lot of immigrant parents, especially mothers in the CNA setting.
Yeah,
And our mom is no exception to that because you can get that license with less roadblocks and start working and making some money to help support your family.
yeah,
Depending on how old you are and what other support you have, you may have the opportunity to go from there, but it just may be what you need and it may just work for you. It's more likely to find older like immigrant parents in those roles for a longer period of time because it is, as more accessible.
it
um
is. Yeah,
yeah. It definitely helps for sure. That's part of the reason why immigrant parents say go be a nurse, go be a doctor.
yeah,
I
it
can
is.
stay here and work as a CNA or home health while you go as my child and go be a nurse and go be a doctor and lawyer. Um,
And yeah, expecting
yeah.
a lot more from you.
Yes. So
Yeah,
it's definitely there's a reason to the crazy story. I know we've all heard the comedian said it many times, but they're not lying. It's very true. Um, okay, I think what I wanted to talk about, which is, talk about the education, the scope of practice. So, okay, one thing I wanted to double check with you. So,
mhm,
in the setting that I work in right now, we have one LVN and we have two RNs, and they run the chemo room essentially. What
okay.
I've come to learn, because I sometimes go there and spend some time there, is that the LVN is not able to administer IV medications. So he can access IV, like he can actually, get access. But as far as administering the medication and so forth, he can't do that. Is that common? Is that a common differentiation in scope of practice that you've observed over there as well? Because I know every state can be different.
Yeah. So RNs can that's one of the things that RNs can do that LPNs are not able to do is administering IV medication, managing IV lines, starting IVs, um, things like that. So that is definitely one of the differences between RNs and LPNs, which is why a lot of the times you won't really find RNs working in hospital settings because
Mm-hmm.
in a hospital, every patient automatically gets an IV, and
You
a lot of
mean LPNs?
yeah. So LPNs, yeah, you're not able, you don't really find LPNs in a lot of hospital settings,
Mm-hmm.
um,
Mm-hmm.
because that's where a lot of IV medication is administered.
Right.
Yeah.
Yeah,
So
that was my learning experience because I was they needed a coverage and I was called on to help, and so he was like, I mean, for me especially at the time I didn't have much experience with IVs. I'm like, last time I put in an IV was in school, and so I was like, I need some guidance here.
mhm,
So he was able to, just sort of help guide me through that and help me with
mhm,
that. But as far as like the actual administration of the medication, even though he knows what to do, he wasn't able to actually do it. So I was the only one who was able to, actually do
yeah,
the act of administering the medication. So I was like, oh, okay, that's interesting. Whereas when I'm working with the RNs, they can do it or have me do it or vice versa. So I was able to learn some of that scope differentiation between the two titles.
yeah,
But yeah, a lot of time you find LVNs end up getting RNs, especially if they get their LVNs when they're practically pretty young. Um, but that's neither
yeah.
here nor there.
They are bridge programs, LPN to RN bridge programs,
Mm-hmm.
for LPNs who are interested in becoming registered nurses.
Yes, yes, yes.
Um, yeah. So, and for me personally, I had to do an RN to BSN program just so I can get my bachelor's degree because a lot of hospitals and even other settings
Mm-hmm.
are preferring BSN nurses as opposed to ADN nurses, associate degree nurses, especially
Yeah,
in hospitals.
yeah, yeah. It's, I mean, every profession, especially in our country here, gets some evolution. Like with time, it's like, okay, associate degree was A, but now it's not. Like even as PAs, when I learned that, we were like, oh, at some point we study as PA as associate degree, and then it was required for bachelor's, and now it's required master's. So it was
Yeah,
like one of our teachers, professors in school she had earned her PA title as an associate, and to us she was like a unicorn because we're like, you know, like
yeah,
as young, soon to be PAs, like we were just set in the masters is required mindset. So that was interesting to see
so she had to go
older.
ahead and get her master's after that.
So she was essentially grandmothered in, so she didn't need to. She ended up getting it anyway, but as far as clinically, it wasn't required of
Mhm.
her, because she had the license and the experience and so forth. And then she was already in a setting where she's in education and not doing direct patient. So that was also a differentiating factor as well. But yeah,
Wow, that's
yeah.
interesting.
And then I know as NPs, it's still masters, but then the DNPs there, that's becoming more common among nurse practitioners as well. So it's wondering if we'll get to a point where they require a doctorate degree for that versus masters, but only time will
Yeah,
tell.
yeah, that would be interesting if that happens. Because I heard right
Mm-hmm.
now a lot of providers that are prescribing medication. Because you heard what's going on in Florida about like um, gender affirming care, um, and all the
So they're
laws.
not allowed to give those medications, right? It's like a lot of
Right.
law.
So
Mm.
so now legally a lot of them are not allowed to. They can be prosecuted for for prescribing any of those any medication that is deemed to be like, considered a gender affirming care. So, and then a lot of providers are nurse practitioners who prescribe most of those medications.
Mm-hmm.
So I don't know. It's interesting. We'll see how
I know.
things.
I don't remember what state it was. It's probably not one. There's a couple of states that are dealing with that in terms of abortion medications as well. So, so yeah, yeah. But anywho, thank you so much for joining me, Duz. I really appreciate your time and getting into this
Thank
with
you
me
for
and the
having
listeners.
me.
Yeah, of course. Well, you have a beautiful day, and I will talk to you soon.
All right.
Okay.
Bye.
Bye. All right, audience, that is all I have for you today. I hope you all enjoyed this episode. If this is your first time here, a warm welcome. And if you're a returning listener, I appreciate you coming back. Please make sure to like, subscribe, share, comment, and connect on all social media. Till next time, ciao!